Celebrating 50 years of continuous service is an amazing accomplishment, and once you actually are involved in any part of it, you appreciate it even more. And in a hospital, which is a 24/7, 365 operation, it means we haven't closed in 50 years. To be able to sustain that at a high level and keep the community in the foreground of what you're trying to do, keep the mission right in front of you, is what is special, and making changes to be able to continue to do important work that people really care about and people really depend on.
Really, it was when the Sisters of the Holy Cross came along with their sponsorship and their drive to build the hospital, coupled with the business community of Silver Spring. They were able to together bring Holy Cross here in the early 1960s. The docs, along with the sisters, helped create this hospital. They recognized the need for a place where whatever your rank, your religion, your color was, didn't matter.
Mother Constantine was very instrumental in the beginnings of this hospital. Mother Constantine was the person who interacted with all of the county and municipal, but mostly county officials to get what now would be considered a certificate of need.
I came out here on the day that the hospital was dedicated in January of 1963. It was snowing. It was very impressive in the snowy background to see the spirit of Holy Cross that was here. It was kind of contagious. It was very exciting, and I knew that they wanted to serve the community well, and they also wanted to serve the underprivileged and the underinsured.
I started here right as it opened. It was a great time. Sister Laurencita, who was the original administrator, was a wonderful woman.
I came 6 months after the hospital opened. I was a radiologist and didn't really know what to expect. It was a new hospital. There were 2 floors that had patients, so it was very limited. And in essence, we had to wait for the x-rays to come out, and we'd be standing there at the machine waiting so we could read them. But as time went on, everything picked up. They found out the new hospital, good service, good doctors, good administration, and then it all began.
Holy Cross was like a model central supply area because we had various modes of transportation from their department. We had what they call a tray bearer system, like an elevator system. Then we had a pneumatic tube system that were smaller items that we could tube it right up to them.
I started here at Holy Cross Hospital in 1970. When I was able to get into the security department here at Holy Cross, as I looked around, my supervisor at that time informed me and told me that I had been the first African American to hold that position. There had never been one before me. That really made me feel good about myself.
When I came to Holy Cross Hospital, there were typewriters. Today, everything at Holy Cross Hospital is computerized, and the biggest change for me that I've seen is the technology, the technological changes.
I started at Holy Cross Hospital in 1981. I've seen the hospital take on so many different looks and features, lots and lots of growth, lots of changes, both in the way that we deliver care as in our size and complexity. And I've noticed over the years how our patient population has even changed and our workforce has changed. Very diverse workforce, very diverse community that we're serving.
I've been here now for 32 years. I've had the opportunity to grow in this facility if you want to remake yourself, if you want to do something different at Holy Cross, you're not locked into one spot. There are so many opportunities for people to serve, whether they're being paid to serve or volunteering to serve.
I was here for 25 years. What's fun, quite frankly, is to walk the halls now and to see a number of people who started in direct caregiving roles who are now playing very key roles in terms of, other functions.
The change in the hospital, it has been tremendous and all towards the positive, what I've seen in the last 22 years. We grew into one of the busiest hospitals in the state. However, the hospital has never lost its focus on trying to serve the needy, which has become such an integral part of this hospital's culture and vision. And the growth of the hospital and the vision have kept pace with each other of being the most trusted provider.
I think Holy Cross has been exemplary in reaching out to the seniors and to those who don't have sufficient funds to take care of themselves. And they have a senior emergency room.
There have been a lot of positive impacts, and most of it involves the growth of the hospital itself, both internally, that physical kind of growth, but also the outreach of the hospital in terms of the community health, the clinics for the uninsured, the building of the new hospital, reaching out in so many, many ways to the different ethnic groups that are in our community.
We've always been the hospital of the community. It's what's so special about the place. It hasn't lost that.
It is pretty amazing to me that our employees come here day after day, carry on cheerfully, carry on with great competence and with great care. Every day I pray with a lot of gratitude for the people that work here because they're incredible, they're amazing.
That spirit still lives here. Still lives here. That joy that I was talking about in those early days, it still lives here. For that, I'm eternally grateful.
And we open our arms and embrace all people, regardless of where they come from or what their socioeconomic status happens to be. And I believe because of who we are and how much we care for those that we serve, that we will be here well beyond another 50 years.
Because of good administration, latest equipment, good doctors, good ancillary help, hospital will live on forever.
As we come to the celebration of our 50th birthday, I feel incredibly optimistic about our future, in part because of our past. I really think the things that attracted people to us will continue to do it, and because of our legacy of the Sisters of the Holy Cross, and because of the things that we have done that position us so well for the future. I'm really excited about the future. I think everybody who's associated with Holy Cross is. Bring it on.